My name is Steve Filoramo from LifeWire News Service. I'm sitting here today with the director of the Institute for Basic Research, Dr. Ted Brown. Doctor, welcome to the show.
How are you, Steve?
I'm well.
Good.
Thanks for joining me today.
You're welcome. Dr.
Brown is from the Institute for Basic Research, and we would like to welcome him into the our studios today. So, Dr. Brown, what are your credentials and what field of study do you do for the Institute for Basic Research?
Well, my credentials, I went to medical school and graduate school. I have an MD and a PhD. Mm-hmm. I specialized in medicine, internal medicine, and then in genetics. So I have my boards in medical genetics. So I'm a person that looks at genes.
Okay.
And I've been the director of the New York State Institute for Basic Research in Developmental Disabilities for the past 10 years or so, but I've worked there for some 30 years.
Oh, and wow.
The Institute was set up about 50 years ago. It's a division of the state office for people with developmental disabilities. We're the research arm, and we focus our research into understanding the causes, treatment, and prevention of developmental disabilities in general. We have some 7 research departments and 45 laboratories. We also have an outpatient clinic, and we have a teaching program combined with the College of Staten Island and with Downstate Medical School.
What made you choose this field?
It's kind of a long story. When I was young, my mother passed away of cancer at a young age. She was 42 and I was 6.
Okay.
That got me really interested in life and death questions.
Okay.
And when I got into medical school, I got really interested in aging.
Okay.
And I did research on a rare disease that looks like premature aging in children called progeria.
Okay.
So when I was done with my medical training and in the internship in the hospital, I decided I would go into genetics so I could find out the cause of this rare disease that looked like aging. And it was a hard disease to study because it was so rare. So I moved on to working on Down syndrome as a model of aging. And I got a grant to understand what the genes are that have extra copies in Down syndrome. And then I got recruited to come out to the Institute for Basic Research and continue my research into the genetics of Down syndrome and then more generally into the genetics of developmental disabilities.
Okay. Since you mentioned Down syndrome, are there differences between autism and Down syndrome?
Yes, there are. Autism is a behavioral diagnosis, and Down syndrome is a genetic syndrome. It's due to having an extra chromosome 21. Now, some people with Down syndrome fit the criteria for autism. They have behavioral features consistent with autism, but many don't. So they're quite distinct in that regard.
So except for autism, are there any other diseases that IBR studies?
Yes, there are quite a few other conditions or diseases that we study. We've had a long interest in Alzheimer's disease because people with Down syndrome have a higher incidence of Alzheimer's as they get older. And so we've been looking at the connection and trying to understand why that's the case. We study Fragile X syndrome, which is the most common inherited cause of intellectual disability. And that's the syndrome that I worked on mostly in my career. And about half of the boys that have the Fragile X syndrome are on the autism spectrum.
Oh.
We also study things like Batten's disease and various other metabolic diseases that relate to intellectual disabilities.
How can you help people with autism or any other disorder or diseases?
We know that if children are diagnosed with autism early in life, say by 3 years of age, and if they're put into behavioral therapy, such as applied behavior analysis, ABA it's called, that a large number of them do quite well and can become a part of the normal community. They can be in regular schools, and the teachers would never consider that they were autistic. So this early training, we know, is important, and so early identification can help. Not only autism, but a number of other conditions, including Fragile X. There are also other forms of therapy, including medications, that sometimes are quite helpful.
You mentioned medication just now. I'm wondering, I don't take medication, I do it holistically. Do you study people like me that do it holistically with vitamins and herbs and things like that?
Well, I think that's good if you find it helps you to take the vitamins that you think are helpful.
Well,
we have been involved with some new drug trials that Novartis and Roche, the drug companies, have been sponsoring to see if they're helpful for people that have the Fragile X syndrome. And they work quite well in the mouse model. We have a mouse that has the Fragile X syndrome, but it hasn't yet been found to be that effective for the boys that have the syndrome. So we're still hoping to find better medications that might alleviate some of their problems.
wow. I'm just thinking off the top of my head here, but has there been any correlation between autism and dementia?
No, I think they're quite distinct. Dementia includes Alzheimer's disease,
Right.
and that's usually a disease of older age people, whereas autism usually gets diagnosed in the first 2 or 3 years of life. And it's something that is present at birth, we think, whereas Alzheimer's or dementia is a process, a disease that it affects, a fair number of people as they get older. So
Okay.
they're not really related.
Okay. So are people with autism more susceptible to other diseases like cancer or?
No, there's not any particular other disease other than some people with autism also have epilepsy, seizures.
Okay.
Maybe 15% or so have seizures at some time during their life. So there is a correlation between epilepsy and autism. But other than that, I can't think of any medical conditions that they're more susceptible to.
This is another question off the top of my head. Maybe or maybe not, does heart disease play a role in autism, or at least genetic markers for heart disease?
Not really, because the genetic markers we think that might be related to autism are more involved with the nervous system. And the heart is a muscle, and it really is quite distinct from the brain, although you have control over the heart to some extent. But we don't think that the genes that might be involved with autism are those that affect heart function or heart disease.
How can we teach people with autism or Down syndrome to more be in control of their faculties?
As I mentioned, behavior therapies, including behavior analysis, seems to help in some people with autism and some people that have other forms of intellectual disability. So that's been proven to be fairly effective by clinical trials. There are other forms of therapies too, behavior therapies that are also being used and are probably quite helpful for some people.
If a young couple came, or maybe during the birthing process, like me, I know, for instance, the umbilical cord was wrapped actually around my neck at birth, and there was some complications with that. That's why I have autism myself. Has there been any further research as far as that's concerned?
Well, we know that autism has both genetic and non-genetic factors that underlie its causation. We think that it's about 50% genetic and 50% non-genetic. The technical word is heritability. So we think the heritability is about 50%. So that if a mother's had a baby with autism and she has another baby, that baby has maybe a 20% chance of being autistic as well. So that tends to run in some families. You can have a mother that's had several children that are autistic. We also know that there are certain environmental factors that might contribute to autism in susceptible people. And as you mentioned, birth trauma can be one. We could have some sort of stress during pregnancy that could contribute to it. We're also finding that there are certain environmental factors such as pesticides. Exposure to pesticides during pregnancy seems to increase the risk. We know that mothers who are pregnant during a hurricane might have an increased risk of having an autistic child. So it's both, genetic and non-genetic factors, environmental factors that we think are the cause of autism in the majority of cases.
Do allergies play a role in people with autism?
And they're not very involved with allergies. There might be some immune components. Some of the genes that are being identified that contribute to it seem to have an immune function, but we don't really relate allergies to having autism. And as you might know, there's been a controversy about whether vaccines contribute to it. But the majority of the studies, almost all of them, have disproven the idea that vaccines in any way cause autism. The original publication was a fraud. It was made up, and it had to be withdrawn, and the doctor that published it lost his license over it, and nobody's been able to show that vaccines, in fact, cause autism.
Gee, thanks for bringing that up, Doctor. Actually, I listened to a doctor on the radio, Savage. He's out of San Francisco, and he seems to think that there's a link between the vaccines and autism.
Well, it's been a controversy. You know, we know that certain people believe that vaccinations have caused it in their children, but, you know, they're in fact, they set up certain courts, the vaccine courts, to give award in case of proving that vaccine caused it. And it's almost never been shown that it caused it. So, you know, legally, it doesn't cause it.
How big are your studies usually?
They've been quite big, yeah. Europe has done some very large-scale studies. Japan's done large studies, and there have been big studies in the United States. You know, in fact, when vaccines have been introduced in Japan, they showed that the rate of autism went down.
Do you ever see a day where the ratio of people with autism and people with non-autism might be maybe 1 in 2?
Well, the current rate, according to the Center for Disease Control, the CDC, in Atlanta, finds that about 1 in 68 babies are born that are on the autism spectrum. Now, that number has been increasing over the last 10 to 20 years, but we think the primary reason is there's better diagnosis, better recognition of it, and also including Asperger's syndrome or high-functioning autism, where that usually wasn't usually included in the earlier studies of 20 years ago. So we don't think that it's going to increase much above where it is now, unless there's some strong environmental factor that can be identified that could be shown to be causative. You know, I mentioned pesticides in California have been linked to it, but we don't think that's the major cause of it. So I think it's not going to increase much over what it is at the present time.
Right. Has there been any link between autism and what's found in animals as far as how we feed them any kind of medications or anything? We
actually have a grant at the Institute from the March of Dimes. And the grant is one of our scientists, Dr. Mohammed Junaid, is studying the effect of folic acid in mice and whether it causes autistic features. Folic acid, we found, is given to mothers when they're pregnant or before pregnancy to prevent spina bifida, spinal cord defects, and it's reduced the rate of that. But it may be if you take too much of it, you can have bad effects as well. And that's what Dr. Junaid is finding, that if you give the mice, while they're pregnant, a larger doses of folic acid, then the pups, the baby mice, after they're born, seem to have some autistic features.
You mentioned about grants. Do you also do any fundraising?
We try to obtain grants from the NIH, from the government, and from the March of Dimes, and from Autism Speaks and other private foundations. We accept donations. Most of us at the Institute are state employees, so our salaries are paid for through the agency, the Office for People with Developmental Disabilities. But they encourage us to go out and get grants as well to supplement what we're getting from the state of New York. I'm, in fact, the principal investigator on a very large grant that comes from the Center for Disease Control, the CDC, that is to do a longitudinal study of people with Fragile X syndrome. And I work with some 20 other clinics in the country where we see patients that have Fragile X syndrome subjects, and we're doing a longitudinal study of how their lives are going along.
Are there any cures being worked on for autism?
As I briefly mentioned before, we've been involved with drug trials in people with Fragile X syndrome. And the idea is that these drugs might be very helpful for some people with autism as well. So we're working specifically with Fragile X, but about half of the boys that have Fragile X are on the autism spectrum. So the hope is that they will be of benefit. We're also doing some research at the Institute on some other drugs in people that might be effective for autism. Drugs such as a blood pressure medicine that lowers adrenaline, and that might be helpful in reducing outbursts or aggression.
So, as far as educationally, are there any links between people with autism and special education from your studies?
There's quite a broad spectrum of in autism. Some people with autism are quite high functioning and some are quite low functioning, and some are in between. We know that, special education is quite helpful for people that have intellectual disability, but not everybody with autism has intellectual disability, and some are quite high functioning, geniuses, in fact. So, it's a mixed picture.
Yeah, I've noticed that myself. I started out in special ed up until mid-year, sophomore year in high school. I was in special ed. So, yeah, I got a first-hand view of that.
Yeah, you know it personally.
Yeah, a little too well.
Uh-huh.
How does Asperger's fall into the spectrum of autism?
Right. Well, Asperger's is a term for high-functioning autism. And the people that have Asperger's, though we're kind of getting away from using that term in the new definition in the psychiatric manual, it's not being included. But high-functioning autism or Asperger individuals typically have normal language development.
Right.
So whereas other people with autism may have delayed language, but people with Asperger's have normal language development. They just have the characteristics of autism that we recognize as different social interactions, difficulty with socially interacting with people, and sometimes repetitive or stereotypical behaviors. But they may be quite normal in terms of their language development.
Has autism been reclassified?
The manual that is the diagnostic manual that the American Psychiatric Association puts out, it's called the Diagnostic Statistical Manual, and it's now in its version 5. And every 5 or 10 years, they revise it and try to clarify it. So the diagnosis of autism comes from this manual. It was in version 3, it really hadn't appeared before version 3. And in 4, it was kind of refined. And now they've come up with some different, more refined diagnostic criteria for the current version. So it's kind of an evolving diagnosis, changing a bit from version to version.
So did it really change because of 20th century modern psychological physicians and whatnot?
For example, the changes that were included in the 5th edition compared to the 4th edition used to have 3 criteria for autism, and now they just have 2. And the 2 that were combined, it used to be that social interaction was one area and language was another, and now they're both part of communication. And that's one criteria. And now they have a severity scale of mild, moderate, more severe deficits in this area, whereas before it was just present or absence. So that's kind of how it's changed. It's not, the basic syndrome we don't think has changed. It's just how we define it.
Because I know from when I was diagnosed, it was minimum brain. I guess basically it can be considered autism, but I'm really not sure.
The diagnosis currently, there are certain tests that people are given to help diagnose it. One is the ADI, the Autism Diagnostic Interview, where a caregiver or parent checks off which characteristics the child has. And if you have a certain number of these characteristics, then they say you're in the autism spectrum. And the second kind of test is the ADOS, the Autism Diagnostic Observational Interview. And what happens is the child is given some toys to play with and interaction with the caregiver or the parent. And for a period of time, they score how the interactions occur. So that, it's usually used in children, ages 2 to 5 or 2 to 6 when you're trying to make the diagnosis. So, those are the gold standards we use in diagnosing it. So it's a test, a criteria in a clinic that helps the clinician come up with a more secure way of making the diagnosis. We don't have a blood test today for autism.
Are there any being developed?
Well, I know there are groups that are working on trying to find them, blood biomarkers, but they haven't had any great success in it so far. So there's still hope that maybe they'll find something, but we don't have a good set of biomarkers that can be used for diagnosing autism yet. One of the questions you might be interested in is, can you get autism later in life? And that's really not seen. You really have it in childhood or, by ages 3 to 5 at least. It's not something like schizophrenia that develops when you're an adolescent or a young adult.
So what are some of the dramatic instances that can cause autism, perhaps after like age 15, let's say?
Well, we know traumatic brain injury, being in a car accident, for example, can damage the brain and leave you with a neurological set of features, syndrome, deficits in your nervous system functioning. Okay. But it doesn't, we don't have the history that leads to autism. It leads more to poor memory or thought patterns or inability to focus or concentrate. It's like, veterans coming home from the Iraq War, for example, with brain injuries may have, personality problems and problems working and functioning, but they're not diagnosed with autism because of the brain injury. So we don't think that's a cause of autism.
Are there any other health issues that can be contributed to autism?
There is some evidence that if a mother takes an epileptic drug, valproic acid, during pregnancy, that there's a higher incidence of having autistic children. So that's kind of and there are animal models giving this drug can lead to autistic features in the animals, in the rats and mice that are studied. There was a drug called thalidomide that was used to reduce morning sickness, and it causes shortening of the limbs. So it was taken off the market, but for a while it was being given pretty widely. And a few of the mothers that took it during the right time in their pregnancy had autistic children. There was a registry in Sweden that was set up, and that was found to be a potentially damaging agent causing autism. We know that German measles, when there was an epidemic in New York, some of the mothers had children with autism as well. So there was some correlation between this exposure to a virus during pregnancy and autism. So those are the kind of agents that we kind of think could be contributing.
Are there any links between mumps and or rubella and autism?
Well, rubella is German measles. Mumps is something else, and that's not been associated with it. There is some evidence relating early infections in pregnancy. If the mother has a urinary tract infection during pregnancy or some other infection that leads her to go to a hospital, she might have a higher incidence of children that have cerebral palsy, but not particularly autism.
How about as far as early colds within the first 6 months of life, where maybe the child loses its hearing or
hearing loss if it doesn't get recognized can lead to the child not being given the proper early training, like a cochlear implant or something that might reverse the condition, and then they can be deaf, or mute and not speaking and not learn language.
Right.
So that can lead to developmental disabilities, not necessarily autism. One other factor that we've associated with a higher incidence of autism is prematurity. If the baby is born premature, particularly very premature, then there's a 2 to 3-fold higher risk of being autistic.
I got you. What would be a message to not so much the parents that have children with autism, but the broader population?
There's this foundation, Autism Speaks Foundation, and they've had commercials on television, pointing out that people need to know about autism. 1 in 68 children are born with autism. We know that there needs to be more dollars spent on research to find, better treatments and better therapies. So that's something that the general population should know. I think there should be a lobbying from parents to get more funding for research. There's a big research effort for cancer, but there's not as much research in autism and other developmental disabilities.
My name is Steve Filoramo from LifeWire News Service, and I would like to thank my special guest, Dr. Ted Brown, the director of the Institute for Basic Research. Doctor, thank you for taking the time to speak to us about autism.
Well, thank you, Steve, for the interview. I enjoyed it. If people want to know more about what I presented or talked about, we do have a website. We're part of the State Office for People with Developmental Disabilities, and the website there, and we have a link within that website. I'll give it as www.opwd.ny.gov, and that gets you to the website. And then our IBR site is within that site, so you can go right to it. There's actually a 10-minute YouTube video that we talk about what we do at the Institute that people might like to look at there. And so thank you very much for the interview.
Doctor, once again, thank you for coming today and granting us this interview. Thank you very much.
You're very welcome.